Hey guys, so today we'll be talking about Remdesivir, also known as VEKLURY. So what is Remdesivir? Remdesivir is essentially an antiviral drug with activity against severe acute respiratory syndrome, coronavirus 2. It is an inhibitor of the SARS-CoV-2 RNA-dependent RNA polymerase, which is essential for viral replication. Remdesivir is a nucleoside analog. The reason nucleoside analogs are so effective is that they resemble the naturally occurring molecules known as nucleosides, such as cytidine, guanosine, or adenosine. Those are essential building blocks for the DNA and RNA that carry our genetic information, which plays a critical role in our body's biological processes. There are differences in the chemical structure of these analogs from the naturally occurring compounds that makes them effective as drugs. So if a virus like COVID-19 incorporates a nucleoside analog into its genetic material instead of the real thing, it will ultimately foil the ability of the virus to replicate. So Remdesivir works when the enzymes replicating the genetic material for a new generation of viruses accidentally grabs this nucleoside, and rather than grabbing the natural compound, and it incorporates it into the growing RNA strand, which essentially blocks the rest of the RNA from being replicated, which in turn prevents the virus from multiplying. So to just recap here, Remdesivir is an adenosine nucleotide prodrug because it doesn't begin as an active compound. It is a prodrug. It distributes into the cells and then it's metabolized to nucleoside monophosphate, which is then phosphorylated by cellular kinases to form the pharmacologically active nucleoside triphosphate metabolite. And that results in remdesivir triphosphate, which is an analog of adenosine triphosphate, or ATP. This remdesivir triphosphate competes with the high selectivity, about four times fold, over the natural ATP substrate for incorporation into the RNA chains by the SARS-CoV-2 RNA-dependent RNA polymerase, and that results in delayed chain termination during replication of the viral RNA. So as you can see here, this figure reiterates what I have already discussed in the previous slide. Remdesivir is a prodrug that is metabolized into an active molecule which resembles adenosine, and it blocks the coronavirus RNA polymerase, which is a key enzyme that this virus needs to replicate its genetic material, which is RNA, and proliferate into our bodies. So the indications for remdesivir include the treatment of coronavirus disease COVID-19 for adults and pediatric patients 12 years of age and older and weighing at least 40 kilograms, requiring hospitalization. This is the type of medication that should only be administered in a hospital or in a healthcare setting. The dosage is pretty straightforward. For adults and pediatric patients 12 years of age and older and weighing at least 40 kilograms, you start with a single loading dose of 200 milligrams on day 1 via an IV infusion, followed by once daily maintenance dose of 100 milligram from day 2 onward, again via IV infusion. The duration of the drug is divided into two subcategories. For patients not requiring invasive mechanical ventilation and/or extracorporeal membrane oxygenation, or ECMO, you start with 5 days. If the patient does not demonstrate clinical improvement, you extend the treatment for up to 5 additional days for a total treatment duration of up to 10 days. Now, for those patients requiring invasive mechanical ventilation and/or ECMO, the duration is 10 days. Remdesivir is supplied as an injection. It's either 100 milligram lyophilized powder in a vial, which needs to be reconstituted with sterile water for injection prior to diluting in 100 ml or 250 ml of sodium chloride infusion bags, or it is supplied as 100 milligram per 20 ml solution in a vial, and that also must be diluted in a 250 ml NS bag. It is administered via IV infusion over 30 to 120 minutes. The contraindications are pretty clear. If the patient has a history of clinically significant hypersensitivity reactions to remdesivir or any components of the product, then it should not be given. So some of the warnings and precautions for remdesivir include hypersensitivity, including infusion-related and anaphylactic reactions. So some of the signs and symptoms you would notice include hypotension, tachycardia, bradycardia, diaphoresis, and shivering. You can consider slowing the infusion rate with a maximum infusion time of up to 120 minutes to prevent these signs and symptoms. Another warning here is the increased risk of transaminase elevations. So you would want to consider discontinuing the drug if the ALT levels increase to greater than 10 times the upper limit of normal, or discontinue the drug if the ALT is accompanied by signs or symptoms of liver inflammation. So another warning here is the risk of reduced antiviral activity when remdesivir is co-administered with chloroquine phosphate or hydroxychloroquine sulfate, which is important to note since hydroxychloroquine was frequently used in the first couple of months of COVID-19. Adverse reactions are pretty straightforward. Again, any hypersensitivity reaction, including infusion-related and anaphylactic reactions, if noted, it should be discontinued. The second adverse reaction includes the increased risk of transaminase elevations. So for specific populations, we'll start with pregnancy. Available data from published case reports and compassionate use of remdesivir in pregnant women, there is not sufficient to evaluate for a drug-associated risk of major birth defects, miscarriage, or adverse maternal or fetal outcomes. Now, this statement comes straight from the package insert. So again, you have to weigh the risk versus the benefit of the use of remdesivir in this patient population. In your pediatric population, the safety and effectiveness have been established in pediatric patients 12 years and older and weighing at least 40 kilograms. And this data was extrapolated from adequate and well-controlled studies in adults. Now, safety and effectiveness has not been established in pediatric patients younger than 12 years of age or weighing less than 40 kilograms. In the geriatric population, no dosage adjustment is required in patients over the age of 65, but you do want to monitor elderly patients due to greater frequency of decreased hepatic, renal, or cardiac function and of concomitant disease or other drug therapy. Now, for renal impairment, there is no dosage adjustment required for patients with GFR greater than or equal to 30 ml a minute. It is good to know, though, that it is formulated with this excipient, which is called betadex, sulfobutyl ether sodium, and that is renally cleared, and it does accumulate in the patients with decreased renal function. So it is not recommended to give remdesivir in patients with a GFR less than 30 ml a minute. So for hepatic impairment, the pharmacokinetic profile of remdesivir has not been evaluated in patients with hepatic impairment. So you do want to perform hepatic laboratory testing in all patients before and while receiving the medication. So in terms of storage and handling, remdesivir contains no preservatives, so any partially used vials should be discarded. After you reconstitute the product, use the vials immediately to prepare the diluted solution. Once the solution has been diluted in the infusion bag, it can be stored up to 24 hours at room temperature prior to administration or 48 hours at refrigerated temperature.